I'm very excited and very honored to be the MC for today's event with this full audience and distinguished guests. I hope together we can contribute to universal health coverage and also UN Sustainable Development Goals.
We understand the private sector has an important role to play in achieving the United Nations SDG goals through our innovation and creativity. However, we cannot do this alone.
When we achieved the universal health insurance in 1961, Finance Minister took a very important initiative to design universal health insurance in Japan and take a very important role how to create sustainability for our universal health coverage.
UHC is the string that pieces everybody together, brings together the JPMA, the pharmaceuticals, the funders, the bilateral, the JICAs, everybody else to support governments to convert all those inputs into favorable outcomes for the people.
Lack of investment in human capital is hampering progress, economic prosperity in countries. The estimates suggest that a child born today in the region is only going to be about 40% as productive as he or she could be if he or she had access to complete health and education.
Even if medicines are cheap, as for example most antibiotics or most hypertension drugs, often they don't reach the patients. Therefore, it's not good enough just to focus on your silo.
The developing countries are unfairly expected to transform their health systems to align itself to the financing. I am a firm believer that even silos have windows, surely, so that even if the silos must exist, there are some avenues upon which we can be able to collaborate.
So partnership is not rhetoric. I think each one should play important roles, and some coordination mechanism is very important.
So this is a great deal of work that PATH has been doing, is looking at data and determining how can we have data gathered but also visualized, so that the intersectoral coordinating committees, the technical working groups, can very easily, as we talked about earlier, consume the data, it's very visual, interact with it, and determine who should I be working with, where are the gaps, what can I do to really move this strategy forward.
One of the things we've learned in the Kumasi City Cancer Challenge is bringing, for example, local government to work with the Ministry of Health and all the other sectors. So we've had these various sectors work together in a way I have never seen in my many years.
Our major role is to really be there for cities, to create the platforms, the tools, and to bring the partners together to support the creation of sustainable solutions.
The innovative approach and the learnings from the city level are particularly unique and really seek to inform our journey.
We have, I think, very good progress in the city council challenge cities and the learning cities. That's encouraging, but if we are not able to scale it up, we will fail.
Each one of us is responsible for creating and getting to those people who are forgotten, or the NTDs, and getting information outside there.
So let's bring theory and practice together.
Thanks a lot.